here's just a list of our disclosures as speakers. Okay, as Valerie mentioned, for today's session, we're really here just to help you increase your understanding as to how to involve knowledge users in rapid reviews. So as Valerie mentioned, I'm going to set the foundation here in part one. We're going to start off with providing some key definitions to center the discussion. As well, I'm going to provide you with some context around the importance of involving knowledge users in rapid reviews and tell you a little bit about opportunities during the review process to get knowledge users involved, as well as some other considerations. Then we'll move into part two, insights from our experts, and then in part three, we'll open it up for discussion. Okay, part one, setting the foundation. So before we get going, we're going to have a quick poll question here just to get to know you a little bit better as an audience. And our question is simple. What level of experience do you have involving knowledge users or key stakeholders in the production of rapid reviews or systematic reviews? Are you a beginner? Are you someone with more intermediate experience or some experience? Or are you a pro and you could conduct this workshop yourself? Just waiting for them to come in here. Okay, it is looking like we have quite a mix of beginners and more intermediate level folks, some with some experience. Doesn't look like there's any pros out there. I certainly don't consider myself a pro either. However, we've started to seriously think about this question for rapid reviews and happy to share experiences here today. So great to get to know the audience a little bit better. Okay. So in terms of setting the stage, we thought it would be really good to start with the definition of a Cochrane Rapid Review, or how it's defined within the Cochrane context. And essentially, this is a long definition, so bear with me. It's a type of evidence synthesis that brings together and summarizes information from different research studies to produce evidence for people, such as the public, healthcare providers, researchers, policymakers, and funders in a systematic, resource-efficient manner. This is done by speeding up the ways we plan, do, and or share the results of conventional systematic reviews, by simplifying or omitting a variety of methods that should be clearly defined by the authors. And what I think is really important about this definition is that it was developed with the input of patient and public partners. This was part of a collaborative effort overseen by Evidence Synthesis Ireland as part of a priority setting partnership on rapid reviews. So in terms of knowledge user, a knowledge user can be defined as an individual who's likely to use research results to make informed decisions about healthcare policies, programs, and or practices. More broadly, it can be an individual or a group who is responsible for or potentially affected by health-related and healthcare-related decisions that research can inform. The term knowledge user is quite broad and includes, for example, clinicians and their professional associations, healthcare policymakers, patients, caregivers, patient groups, researchers, can be government agencies, as well as the public. For our purposes, in the context of rapid reviews and some of the work that we've done, we're really talking about patient and public partners, which in the Cochrane context is often referred to as consumers, as well as healthcare providers and policymakers or decision makers. And the main goal of knowledge user involvement in health research, ideally, is to co-produce or co-create evidence that's relevant and useful for making real-world healthcare decisions, ultimately to help increase the uptake of evidence into practice. So talking a little bit more now about the importance of knowledge users. Active knowledge user involvement is widely accepted to improve the quality, relevance, and impact of health research. We know that there are several national strategies in many countries that emphasize the importance of involving knowledge users in all research activities, including both primary research and knowledge synthesis. For example, in Canada, for some time now, we've had the strategy for patient-oriented research, which has culminated into the Spore Evidence Alliance. In the UK, there are groups such as the James Lind Alliance and Involve, which is funded by the national government. And in the US, there's PCORI, which is the Patient-Centered Outcomes Research Institute, which is doing similar work in the US. So for rapid reviews, we really think of each knowledge group as offering a unique perspective to inform the goals or objectives, questions, outcomes, as well as the interpretation of your research findings. Close collaboration with knowledge users is really important to ensure the feasibility and relevance in the context of timely decision-making, especially for rapid reviews. We know that there's one study that actually suggests when knowledge users are involved in rapid reviews, it has considerable impact on study results, making them more relevant to patients and policymakers. So just a little bit about knowledge users and rapid reviews. As most of you know, rapid reviews have gained traction in the field of evidence synthesis, especially in the last few years, as they offer a quicker alternative to mainstream systematic reviews, which we know can take a lot of time and a lot of resources, really making them valuable in situations where rapid decision-making is required. They've proven useful, for example, in emergent situations, for time-sensitive clinical decisions, as well as rapid guideline development, among examples. Formal involvement of knowledge users, we do have some research on this to suggest that it's often limited, omitted, or not reported in the conduct of rapid reviews. But we do know that based on systematic reviews, there are potential ways that we can actually involve knowledge users in reviews to varying degrees throughout the process. What's missing really is guidance on how and when to involve knowledge users meaningfully in rapid reviews, given the demands of shorter timelines to complete them. So just a little bit more in terms of knowledge users in rapid reviews. Rapid reviews themselves often necessitate the involvement of policymakers or decision makers as commissioners of rapid reviews or requesters. And healthcare providers are often involved as experts, as well as important end users of rapid reviews. But it's also important to remember the patient and public partners because they play a crucial role. And ultimately, they're the end users of research evidence from rapid reviews. For meaningful patient and public partner involvement in rapid reviews, which we know is lacking or missing, we need to think about innovative approaches to get all types of knowledge users involved. There was a recent research setting initiative that took place where the top 10 rapid review methodology research priorities were identified through a James Lind Alliance priority setting exercise. Again, this was conducted through Evidence Synthesis Ireland. And the number one question of these top 10 questions was, what are the best approaches to identify people or groups who will use the results of a rapid review? For example, your stakeholders, such as patients and the public, clinicians and policymakers. And how can they have meaningful involvement in planning and doing a rapid review and in reporting and sharing a review? So just to say, it is on the radar, and I think it's important to point that out, that there's a lot of work to be done in this area. And so anyone who's looking for research topics in the area of rapid reviews, this is one for sure, where there's a lot of work to be done. We also just wanted to point out that although there may not have been a lot of methods up until this time about how to involve knowledge users in rapid reviews, the Cochrane Rapid Review Methods group has put together some guidance, some interim guidance, and we're currently working on updated guidance, which we hope will be forthcoming in the next few months. Our first recommendation is to involve knowledge users to set and refine the review questions, the eligibility criteria, and of course, outcomes of interest with consultation at various stages of the rapid review. So again, just to know, this is on our radar. And as such, the Cochrane Rapid Review Methods Group has been leading a series of papers in BMJ's evidence-based medicine to guide general rapid review methods. And the first paper that we put together discusses the importance of involving knowledge users, as we're discussing today. And it outlines opportunities to involve knowledge users in the planning, conduct, as well as in the KT and dissemination efforts, as well as various modes of engaging them during the rapid review life cycle. It also offers research teams some suggestions that they could consider to help facilitate their involvement. So in terms of ways of involving knowledge users in rapid reviews to varying degrees, this can be done across all stages of the review process. I'm just going to touch on a couple of highlights here There's obviously more detail in the paper that we refer you to, but just to say, there's obviously a fully integrated approach you can have where a knowledge user at one end of the spectrum is involved in absolutely co-producing every element of a rapid review. And then at the other end of the spectrum, they may just be providing information or receiving information about a review. So there's varying degrees in which to get your knowledge users involved. But some of these at the pre-planning stage include, they can be providing help with determining the relevance of a topic and to identify priority areas for rapid reviews. You can get them involved in developing a knowledge user recruitment strategy. They very well likely know of others that might be suitable to be knowledge users or get involved or have interest in getting involved. You can get them involved in co-developing an engagement policy or a plan. Get them to help you conceptualize a review topic before you get to the initial planning stage of a review. And more generally, they can help you foster relationships between other knowledge users and researchers. Then at the initiation and planning of a rapid review, you could get their input on defining the research questions and review objectives. You can get them to help prioritize and define the outcomes of interest. They can be reviewing your protocol. They can help set your eligibility criteria. They can also provide seed articles to help with some search efforts. They also can look at your search terms to see if any terms are missing in terms of your literature searching. And during the actual conduct, during what we're calling phase 3, they can, again, actively participate in screening, selecting, extracting articles, which doesn't happen very often. And obviously, there's some caveats to that. Or more commonly, they could provide input about specific studies meeting eligibility criteria. They can help identify data extraction elements. They can provide input into your analysis. They can be providing context or interpretation of your findings. And they might also get involved in potentially drafting a section of the report and definitely reviewing the draft. And if they're drafting a section, maybe it's key findings or implication of research findings. So again, various ways we can get them involved. And then at the end of a review, get them involved in developing key messages. They can be involved in writing or reviewing a plain language summary, and they can really help with promoting a rapid review within their various circles or networks. So just a little bit more about ways and levels of involving knowledge users. At the outset, what we'd encourage you to do is to look at the active framework, which describes quite a range of methods and approaches for involving different types of knowledge users in systematic reviews. What it does, and I won't go into much detail, but it outlines a continuum of this involvement, as I referred to earlier, from simply receiving information about a review to actually leading the initiation and completing a completion of a review. And so by extension, this could actually help support rapid review authors in planning and reporting knowledge user involvement at different stages. So I've just given you a snapshot here in the figure of what that framework looks like, but I would encourage folks to take a look at the article itself. There's also different modes of involvement. So as with systematic reviews, each rapid review can employ a combination of different methods during the review lifecycle. You have to really think through the time pressure in a rapid review in terms of the modes you might want to think about using. So for example, workshops and interviews, that's going to be a little bit more time consuming. So maybe it's a little bit more helpful for rapid reviews that have a few months or more time in terms of their timeline for conduct. But then on the other hand, for more urgent rapid reviews conducted in less time, ensuring that there's regular communication and emails or a short survey might be easier in terms of integrating the knowledge user feedback into the process. And of course, I'm saying, really think strongly about using some of these ways and modes of involving knowledge users. But of course, I think we have to talk about some of the challenges to doing this in rapid reviews. I think first and foremost is lack of know-how, how to do it properly. And so if researchers don't know how to do this, or they don't understand some of the strategies for effectively involving knowledge users, this can really result in more tokenistic involvement or symbolic involvement. And in some cases, researchers may even opt to forego involvement altogether. Lack of time. So obviously, rapid reviews don't have a lot of time. We're working under extreme pressure quite often to get rapid reviews done. And obviously, this can make it really hard to involve and work closely with knowledge users. It's really tricky to try to identify people on the fly, and to do this quickly and to properly prepare for their involvement. It's also hard to just find times that work for everybody. So definitely that is a barrier that needs to be considered. Also, lack of funding. We need some resources and funding to do this. And we know that rapid reviews frequently are done with limited resources, and it can make it hard to involve them, especially meaningful involvement. And I think, too, there's a belief that involvement won't work, or it's just going to slow things down, and thoughts that knowledge users can really make the process more complex. And I think this might mean the need for more time and expertise to manage this whole process properly. And then when you're thinking from the perspective of knowledge users, there might be a belief that their views just won't matter. They might not think, well, I don't have enough experience to actually get involved. I wouldn't know what I was doing. Or that their thoughts wouldn't really influence the process. And in some cases, the belief that the findings are already decided in advance. So, why bother? So again, things to be aware of, and with the aim to try to mitigate these as quickly as possible. So some of the other considerations that we've put forth is, and again, I'm just going to touch on these briefly, but be prepared. I think ways to circumvent some of the barriers are, make yourself knowledgeable of knowledge user engagement methods. Start to think about the resources to involve knowledge users. And be mindful of methods that promote equity, diversity, and inclusion within rapid reviews. Think of it through that lens as well. And we've provided a link to some references that have been put together by the Sport Evidence Alliance, which again, we'd encourage folks to take a look at. Make sure in advance you develop an engagement plan. You need to have a description of roles, training needs, logistics, resources. All of that should be in your engagement plan. Also, think about what resources, especially the patient partners, might need. For example, access to a computer or an internet. They might need access to screening software and possibly training to even participate. Also, another consideration is think about highlighting the patient and public perspectives. So maybe you include a separate section devoted to part of the rapid review report or summary, where they actually get to write their own interpretation of the findings. This could be a means of getting the patient and public voices closer to that of the healthcare policy or decision makers. Also important, report knowledge user involvement. Authors should describe all the involvement in the methods section. There are some tools. The GRIP2 is a reporting checklist that folks can follow when reporting involvement in research in general. And there's also a checklist short form that they can use. Evaluation is also important. And thinking about evaluating knowledge user involvement from all perspectives, including those of the researchers and the knowledge users, because there are lessons to be learned on all sides. And there are existing tools that could be adapted for use with rapid reviews. And attention to the potential barriers. Try to monitor any barriers, obviously in advance, as well as throughout the process to mitigate these issues. And then just to drive home the notion that, if you're thinking about knowledge user involvement, start early. Try to think about developing knowledge user partnerships before conducting rapid reviews. You can assist knowledge users or groups of knowledge users to help them prioritize questions of most urgency. You can recruit a roster in advance, possibly do some training in advance of knowledge users. And the earlier they're engaged, the more they will know about it and be able to effectively contribute to the process. Provide training. Assume that both researchers and knowledge users on the team will need some degree of training. And we're trying to emphasize that in addition to experts, the decision makers aim to engage more than one patient or public partner in your rapid review. And think about compensation for patient and public partners in particular. How are you going to provide fair compensation? You have to think about reimbursement for meeting and travel related expenses, etc. So some of the things to think about as you're going through this process. And here's just a list of some of those tools and resources that we cited on those last two slides. And again, these are all freely accessible and would encourage folks to check them out.